Hey everybody, welcome back to the GEMS podcast. Excited to have you here. I'm at the Crossroads Emergency Conference. It's a joint conference between the Emergency Nurses Association and the Indiana EMS Association. I am joined by Dr. Eric Yazel. He is the Indiana EMS Medical Director, and he's going to be teaching a class at FDIC in 2026. So I thought, let's sit down, let's talk about his class, let's get to know him a little bit, and kind of learn about some up and coming things for Indiana, some changes that are coming with EMS, and some things to be excited about since FDIC calls Indiana home and has for quite some time now. So
awesome, yeah. Thank you for having me. Yeah. I'm glad to be here. Quick plug for the Crossroads Conference. Great conference. Good collaboration between the Emergency Nurses Association and the EMS Association. Lots of good content. So been a great experience, and get to make a lot of connections like we did. So it's really excited to be here.
Yeah, awesome.
I'm just to tell you a little bit about myself. I'm starting my, I think, 4th year now as the state medical director for Indiana. I still practice clinically, both at the University of Louisville and at Norton Clark down in southern Indiana, and actually work with a mental health organization as well. And I'm a local health officer, so a lot of different hats going on right now, but they all interplay with pre-hospital care, and so it's been a good time.
Awesome. University of Louisville?
Yes, sir.
What's your favorite bourbon?
Oh, that's a good question. That's a good one. Probably Weller's. Yeah, that's probably I'm not a huge bourbon guy, but that's but you have to be to some degree if you're going to be in Louisville. So
100%, 100%. And I am saying that right, Louisville.
Oh yeah, You gotta say it like you have a bag of rocks in your mouth. That's the try to move your mouth as little as possible as you say it, and you'll come out okay.
Awesome. So, well, you're gonna be at FDIC in 2026, giving a talk on something that's near and dear to you. So
like a lot of other states, Indiana is experiencing a lot of maternal health deserts. A lot of our critical access hospitals are stopping their OB services, at least from the inpatient side of things, and that creates some barriers for prenatal care. And then our pre-hospital providers are delivering more babies and sicker babies. And so figuring out our role in that, supporting our providers, giving them the tools they need to respond, and then looking at ways we can fill in the other gaps in our community with that. So excited to talk at FDIC. Proud to represent EMS in Indiana by having the conference in Indianapolis. So, and hopefully we get a lot of turnout. So.
Okay. Absolutely, that's what we're shooting for. So what's new in Indiana for EMS? What's happening?
Well, again, like a lot of other places, the Rural Health Transformation Act's a big priority of ours, which is a kind of the backside of the One Big Beautiful Bill. They know some of those changes will disproportionately affect our rural areas, and so we're looking at ways to transform our rural health care delivery model, and EMS is a big role there. You know, the interfacility transfer side of things is going to be under the microscope, giving ourselves resources trying to move our patients from our critical access facilities to tertiary care. Maternal health, like I talked about, is obviously a big priority. We're trying to make every EMS unit in the state pediatric ready and maternal health ready. And so that involves education, equipment, high fidelity SIM, a lot of things like that. So those are our priorities. And then also developing a statewide whole blood for ground-based EMS program. We're up to, I think, 10 different ground-based services now, and they are sharing in their local area. So we do have some large swaths of the state covered, but we'd like to have a coordinated response so that every citizen of Indiana has access to pre-hospital blood.
That's awesome.
Yeah,
that's where it's at when we're trying to really make a difference in death and disability and trauma. You got to give them what they're losing.
I heard somebody quoted one of the fire chiefs somewhere down south said that it's been the biggest change in EMS since the seatbelt, and I agree. Almost every program in Indiana, at least, has had a pretty remarkable save since they started their program. So yeah, I just think it's a huge step forward for EMS and for our citizens.
Awesome.
Yeah.
Well, very exciting. Yeah. Thanks for spending a little bit of time with me. I appreciate it. I'm looking forward to, if I don't see you between now and then, seeing you in Indianapolis.
Absolutely.
We'll
probably
2026.
We'll probably cross paths, but I'm excited to get there, and FDIC is going to be another awesome week, just like it always is.
Yeah.
Excited for it.
I'm really excited also to have you there, to be able to see all the changes that are coming from an EMS standpoint, all the workshops that are going to be running throughout the week, and the tremendous cadre of instructors, including yourself, that's going to be there lecturing. So excited to have everybody to the great state of Indiana and Indianapolis in April next year. We'll see you then.
Sounds great.
Thanks, Doc. Appreciate your time.
Thanks for having me.
Yep.